Hi everybody, hey, it's Dr. George Foedisch again. This time we're going to talk about again the lumbar spine or low back spine because we're in low back month. Again, just a real quick recap. Anatomically, what are the parts of the lumbar spine? These are 3 lumbars. We have 5. This is the vertebral body. That's the vertebral body. That's a vertebral body. It looks like a box. I call it a brick in a building. It's supposed to hold up your building. It's supposed to hold up you. Supposed to hold up your body. The cushion is the disc. You've heard about herniated discs, prolapsed discs, slipped discs. That's what it kind of looks like. That's where it is. It's between the vertebrae to absorb force. Back here are the joints. I call them like the hinges on a door. So when you bend and slide and move around, that's where it actually occurs primarily. It's not supposed to bear weight. So in this video, we're going to talk about what happens when this gets in trouble. And we'll start to introduce you to some things visually that you can see, that the doctors get to see to start to identify the problems that the patients and practice members come in with. Also, we've talked about the anatomy in addition to the bones and the discs and the joints. This foramen, or this hole, is where the nerve comes out of. So if that gets compromised, wherever this goes starts to get in trouble. Now, last concept before we talk about dysfunction is this idea of a cocoon around your spine. It's embedded in this ligamentous, real tough, fibrous tendons, muscle, and fascia cocoon, and it gets stiff and rigid if this isn't moving. One other concept I'd like to bring to your attention is this idea of you thinking about a bicycle chain. It's made up of a bunch of links, and all those links have to slide and glide to do their job. These links, if we call the vertebra that, they have to move to allow your spine to be as healthy as possible. So it takes less and less strain. The tighter this gets, the more strain occurs. And we start to get this entity that chiropractors call subluxation, which is where this movement gets in trouble and starts to impact the neurology and not just bones. So I think I'm going to say that, in my opinion, the first problem that most folks deal with is that cocoon starts to get tight and stiff and rigid because of abuse. Just overuse, either from sports growing up, gymnasts, dancers, contact sports, and it starts to get tight, and that starts to limit this functional motion. And then as that happens, one area will get more worn than another. We start to get a degenerative condition. I don't know if you can see super clearly on here. This is 5, 4, 3, 2, 1. Between 2 and 3, that disc is starting to get narrower because it's actually starting to die. That's called degenerative disc disease. That happens because the disc has too much force on it, and it just starts to rub out, just like the sole of your shoe or the bottom of your shoe if you're walking on a weird angle. I want to show you herniation. Herniation, I want to make 2 comments about the disc. Your discs don't do well with compression, which is straight on force. So every safety talk that I do, I tell everybody and I plead with everybody not to jump off of anything anymore. If you land wrong, you can truly insult that disc and it starts to get in trouble and degenerate. But let's see if I can get this close. That is what a herniation looks like. And it starts to put pressure on this nerve, and wherever that nerve goes, it starts to get in trouble. You can get pain, tenderness, you can get numbness, and you can get weakness in that leg. And you can manifest other neurological symptoms that are far worse than that if this isn't managed appropriately and quickly. Arthritis, you always hear about that. Everybody says that you have that over 40. These joints start to get like cauliflower on them, and instead of nice smooth joints, they get rough. Those are just a couple ideas and visuals that I wanted to introduce to you today. So your spine, your lumbar spine is 5 vertebrae. It needs to move appropriately. If it doesn't, certain things happen, and we get to identify them on x-ray. That's how we know what we need to do to help folks with this subluxation pattern, this joint dysfunction issue, so you can have a healthy spine, so you can have a healthy life.